have access to effective prevention programs such as education, condom distribution, prevention of mother-to-child HIV transmission, and HIV testing. We believe that the new HIV infections could be significantly reduced if effective prevention programs are expanded and reach those at the greatest risk of the infection. The global momentum behind the call to find a cure for AIDS epidemic has reinforced the case for the use of a combination of preventive strategies. The past 10 years of HIV prevention activities are beginning to show results. Despite the enormity of the challenge we still face, the number of new cases of HIV/AIDS annually have shown a substantial decline from about 270,000 cases earlier to about 120,000 cases. And at this point of time, may I pause to pay my fulsome tribute to the extraordinary effort which has gone into the cause led by my good friend Oscar Fernandez and his team of parliamentarians in spreading more information and educating more people about the enormity of the challenge and the need to take it on a mission mode, not only nationally but globally. If scaled with resources and a sense of urgency, a preventive strategy supported by other key interventions can save lives, prevent new infections, and lower the cost to fund the global fight against AIDS. Significant recent research breakthroughs in the area of HIV prevention, particularly in terms of ARV-based prevention methods such as pre-exposure, prophylaxis, and provision of early treatment to prevent HIV transmission are important contributions in the ongoing research. We must find ways for developing vaccines that help us overcome the difficulties posed by nature. The insights and lessons from recent advances in the field of HIV vaccine, R&D, particularly the findings of the RD-144 and the discovery of the broadly neutralizing antibodies, give us hope and a sense of optimism. Given the complexity of the task, the best minds must work together in furtherance of the objective of collaborative science. One of the most important features within the first century science is it has ceased to be competitive, it has indeed become collaborative. And that is primarily in response to the reality of the situation, namely that most of the challenges in the medical field that the nations and the world indeed faces are challenges in common. Therefore, we need collaborative science rather than competitive science. We are delighted to learn that some of the leaders in research are participating in the science symposium being organized as a part of this meeting. I am sure that this meeting will instill great hope in the people of India and indeed worldwide who are looking towards science for evidence-based prevention interventions for HIV, such as the requisite vaccine. It is noteworthy, ladies and gentlemen, that all research agencies, be it in the Ministry of Science and Technology or the Ministry of Health and Family Welfare, are indeed working together and have established close and effective collaborative efforts for accelerating our research work. And this national effort is closely networked with leading AIDS research institutes in the world. The Union Ministry of Science and Technology, which I have the privilege of presiding over as the Minister of State, is encouraging our best scientists and technologists to engage in finding solutions to major public health challenges such as AIDS, TB, and malaria, etc. We have also floated many novel mechanisms by which academia, industry, and public health experts can work together to develop effective preventive and therapeutic technologies. We are establishing a large number of centers of excellence where science, medicine, and engineering can be linked to design novel solutions and technological developments. A fine example is the HIV vaccine design program which has been established by our Department of Biotechnology. And I would like to pay personal tribute and compliment our Secretary, Department of Biotechnology, Mr. Khan, who is in the audience, for outstanding work in this area. The collaborative partnership between Translational Health Science and Technology Institute and the International AIDS Vaccine Initiative is indeed an initiative of global proportion and worthy of global recognition. The research work will aim to understand the biological processes connected to the HIV infection to design a novel vaccine. The focus will be on the subtype C of HIV found in India predominantly. In conclusion, ladies and gentlemen, let me take the opportunity to once again express our immense pleasure in hosting this conference and in welcoming you to this event of seminal importance. May I congratulate the local organizing committee, distinguished guests,